Hi everybody, this is Dr. K from Holistic Minds. Today is my privilege to introduce Dr. Kathryn Gill to you. She is a physician that practices osteopathic medicine, especially focused on little children, and she has so much wisdom to share that I'm really excited that she's here. She did her preclinical years at Dartmouth, then went on to Brown and finished her medical school training, then went to UCLA and did family medicine. And what is so unique about Dr. Gill is she's an MD that has chosen to practice osteopathic medicine. So, part of why I had Dr. Gill here is because I am sure that most of you don't even know what osteopathic medicine is, and they have no idea even what the impact of this can be for their children. And I mean, I have seen you with my own eyes transform children and just seen them blossom into these incredible, balanced human beings that were struggling so much. And that's why I'm tickled to death that you were willing to come. So thank you.
Well, thank you for inviting me. It's great to be here. I'm excited to talk to you about all of this.
Thank you. Thank you. So maybe we can just start off with you sharing how you see osteopathic medicine. What is osteopathic medicine to you, and what would our audience want to know about osteopathic medicine?
Well, I think, there's profound things about osteopathic medicine. I think there's also a very straightforward and simple way to talk about it. And I think I'll start with that. If you want to think about it as engineering for the human body. So the osteopath is interested in how is your whole body functioning? What is the structure of your body? But there's tremendous precision in that question. So the man who invented osteopathy invented it at a time when we didn't have medications and surgery was pretty barbaric, and people were dying. And he figured out that the physics of the human body actually determines the biochemistry. If we don't have normal structure, we're not going to function very well. And that structure is not just our whole body, but the importance of the structure goes all the way down to the cell level. And this is pretty fascinating. There's a lot of research that actually supports this. I was just at a conference where they did research on the formation of breast milk, and they used a mouse model. And they harvested some cells from mouse breast tissue and put it in tissue culture. And those cells became very disorganized and they stopped making breast milk.
Wow.
They then created a fake gel circular container for the cells. And they put them around the perimeter of that circular container, mimicking a breast milk gland. So the structure was put into the petri dish. And lo and behold, those cells organized themselves and started making milk. So I'm giving you that very funny or odd example because I want you to understand that our structure is profoundly important to how we function. Whether a nerve can do its job, whether a red blood cell can get into the tiniest little blood vessel that's too small for the normal diameter, normal size of a red blood cell. In order for it to do that, it has to fold. And so if you don't have a functioning folding red blood cell, it can't reach that very important tissue that's hungry for oxygen and nutrition. It might be your brain. It might be your kidney. It might be a muscle. So osteopathy is all about exploring and treating very large abnormalities in our structure, all the way down to very small abnormalities in our structure at those tiny little levels. Even in a capillary.
I love that you can focus in and understand the structure at every little level, because I think most people, when they think of body work, they think of chiropractic and it's like, oh, well, a bone is out of place, I'll just go get it knocked back in. And what you're talking about is profoundly different.
It's very, very different. Of course, we can and we do spend a tremendous amount of time studying the bony structure. And I think that Andrew Taylor still named it osteopathy because he started with the idea of studying the bones as a framework. We all have to have a reference point, when we study science. And so certainly the position of the bones has a very important effect on what's inside of it. If you take the container that's the head, when I first started thinking about osteopathy, I was a pre-medical student and I thought the head was one bone.
Mm-hmm.
And it's not. It's made up of 22 bones. And in children, in newborns, each of those bones has developmental pieces. So there's a lot of pieces that form the skull.
Mm-hmm.
If, perish the thought, somebody has a serious head injury, they can bleed into the place where they've been injured. And that blood actually starts to take up space of the nerves and the brain.
Hmm.
And what will happen is at first there may be personality changes, and then that person will then possibly stop being able to use part of their body, their arms, their legs, and then they may go into a coma if the bleeding progresses. So that's a very big example of how something that takes up the space inside the container, it's a limited container that we're not expecting in head trauma, can change our behavior all the way down to our consciousness.
Wow.
So, when an infant is born and they go through the birth canal, that causes a tremendous change in the structure of the entire body, not just the head. But, you all know that many of the babies go by their head first, right? And some of you have had the experience of giving birth to a child whose head looks a little cone-shaped, and you kind of wonder, is this going to ever get better? It can get better. Osteopathic practices and science and evaluation and treatment can vastly make it get better, because we don't just treat the head, we treat the whole person. And that's probably the most fundamental, important thing about osteopathy. We see all of you, as A.T. Still said, man is triune, mind, body, and spirit. None of those things can be ignored. We can't separate your feelings from what happened to you or your thoughts. All those things have to come into context. So if I just, rework the shape of your ankle and ignore that it's attached to the rest of you, your body has to spend a lot of time bringing that back to the whole of you. It has to reconceptualize what I've done. If I move in and give a treatment and move around the furniture without thinking that there's a person living inside of that house, that body, they're going to have a very disrupted experience from the treatment. Yeah. But we don't just deal with bones. We deal with blood vessels, organ position, organ function, the nervous system, the fluid patterns, fascia. One of the fascinating things that my teacher could do was he could lay his hands on somebody's body, and he could tell by assessing the fluids in the body how well their balance of chemistry was. He could tell whether their thyroid was low. He could tell if they had low calcium. That's not something that I know how to do, but there's a wide variety of skill in the osteopathic profession. And I think I should mention really quickly that our two greatest tools are the mind and this. And there's nothing in science, in all of the research that we've done, all the inventions that we've created, that is as powerful and sensitive as the human hand. Remarkable. You can reach in your pocket and have a conversation with me and pick out a dime instead of a quarter, because you've learned exactly what a dime feels like. An osteopath can lay their hands on somebody's foot and they can track through the tissues and tell you what the fascia in their neck is doing. Or they can tell you about the position of the diaphragm, because they've spent hundreds of thousands of hours studying that anatomy and studying what it feels like directly, as well as from a distance with a teacher working with them.
I mean, I've seen you do this because I remember, I'll say this. I remember when I was a student early on, it was my third year of osteopathic medical school, and I rotated with Eric Dolgen, DO. And as a student, I would be on the person's ankle trying to feel what was going on, and I was like, I think I feel something. And then he'd be on the neck. He's like, do you feel that strain in the ankle? And then he'd turn to the patient and say, did you twist your ankle 2 weeks ago? And then they're like, yeah. I'm like, great, I just missed it again, But I think that's where, amateur student that knows nothing, versus someone like you who has spent, how long have you been doing osteopathy?
28 years.
So just a few years,
Yeah.
You have a little bit of experience, but in all of this time, you have refined your sense of touch to the point where it picks up on the most minuscule things that the vast majority of people would never even know exist. And, for our audience, I really want people to understand this, because personally, I think that at least 20, if not 30% of kids with various behavioral issues have structural causes, not little problems, but actually the reason why their nervous systems are going haywire is because structurally something is off that ultimately is causing their nervous system to not be able to function.
Mm-hmm.
And would you say that that is probably a decent guesstimate in terms of?
Sure. I mean, I in my practice, because I'm
That's
skewed
cool.
in that direction, I see a lot more of that. But I think it's such an important aspect. Some children actually don't have the idea that they have two legs. Their brain has not figured out that hardwiring, and those are the children often who have difficulty crawling or difficulty figuring out the left and the right side. They literally are not getting the information, the appropriate information from their nervous system. Do they have a sensory nervous system? Of course they do. But something might have happened to it during the birthing process or, during their life or maybe just when they were being formed that changed how easily their brain was going to get that information and be able to interpret it. Just like somebody might have eyes that are going in different directions. If you have strabismus, where eyes don't come together and help you to look at what's right in front of you, you're going to get an abnormal message to your brain. And then your brain has to pause and figure out, well, what am I actually seeing here? And that's really difficult for a child because they want to play and they want to be in their world and they want to interact with you. But to have to, even in a conversation, not know exactly where you are in three-dimensional space and what your facial expression means because they have to keep rewiring what that eye that's not behaving is telling them. That's a big task.
Yeah. So life for these children is a struggle because they're not integrated into their body. Mm-hmm. So it's like their mind and body are kind of disconnected. Mm-hmm. They're lost in space because some element of how their body is functioning physically is off, right? So the way their body takes information and the way their mind can understand that information is ultimately disconnected, right? And this is just one of multiple pieces that can cause these children to really struggle. And these kids really struggle. And
they do.
I think that's the sad part. Ultimately they get the label of anxiety or ADHD or whatever. And I hate all of these diagnoses because they don't tell us anything about why the child is suffering, right? We slap on a label and then we try to throw them on a medication until they get worse. And I've seen this all the time. So we give them these diagnoses without really taking a step back and say, why in God's good earth is this 6-year-old having anxiety? Or why is this 6-year-old, acting out in class? Because children don't want to be bad. And that's the whole reason why I created this system, because I've really come to see children don't want to be bad.
No.
But sometimes they can't help but acting out because whatever it is causes them to just be dysfunctional.
Mm-hmm. I think what you just said is so important. Why? And that comes from your osteopathic training, absolutely. In allopathic training, you're right. We give a diagnosis, the patient comes to us, we give them a diagnosis. Oh, I have a diagnosis. But what did that actually really do for them? The question of what are all the different pieces that came together to cause this disruption? And I agree with you. I treat adults and children, but mostly children. And one of the biggest difference about treating children is they have this attitude of yes. If you give them a little bit, they try their best to run to the end of the football field, and that's the way they are. Adults are, how much is it going to cost me? I don't believe this works. I don't think this is real. There's a lot of doubt, and they're comparing it to their past history. But a child lives in present time, and that's a powerful, powerful piece of information. Also about osteopathy, they're here now. They could care less about what happened yesterday. They're here now. They work at a different rate, and that affects their consciousness, their observational skills, what they're interested in, how they use their bodies. And so to me, getting to a more I don't know what you would call it, a comprehensive view of osteopathy, is I'm interested in what can osteopathy do to support your child's reaching for their potential.
by taking away the blockages that are keeping them.
Exactly.
Because physically, there's something blocking them from functioning optimally. So you take away that blockage to allow their vibrant, healthy self to express itself.
Right. And that's why it's so hard when a parent says, well, what did you do? Well, a treatment might be because somebody's having neck pain, but during that treatment, their diaphragm's going to work better. That means they're going to get more oxygen to each red blood cell that enters the right side of their heart, and then, the left side of their heart, and then goes out to the rest of the body. That's a big thing. So maybe you're changing oxygen delivery by 2%. In an elite athlete, that makes a huge difference. In a child who has difficulty focusing, it also makes a huge difference. But, we're changing circulation, breathing, how muscles function, what the report of the sensory system is from the body back to the head, and discovering new things. I mean, I've just learned at this conference I just went to that the heart actually sends an electromagnetic, a nutritive, oxygen-containing message, as well as a sound message to every cell in the body. And not only that, every cell in the body is designed to report back to a specific part of the heart. I didn't know this.
That's amazing.
And that's what the research is pointing to.
Wow.
So when we start to understand these kinds of nuances, we can have even greater impact in how we can support children. Anyway.
No, I appreciate you sharing this. And, at the end of the day, I think what you need to understand is that little pieces like this, which for some of you may seem like this is far out there, are actually where the imbalances and struggles of these children may be. And it's interesting that you touched on birth, you touched on not crawling, because I remember one of the first cases that I sent to you that really caught my attention. And for me, with each practitioner I work with, it's kind of like micro-testing all the time. And I remember the first one I sent you, they had a difficult birth. It was like a 8 or 9 month old that was dragging their left leg. They weren't crawling very well. And one treatment later, they were just crawling along and everything was fine. And over time, I think by having the privilege of working with physicians that practice osteopathic medicine like you, I've also kept learning and adapting and expanding my own understanding of things, because we've collaborated on countless cases now. And I've seen where the changes in the children come. And now, if I see that the child had a difficult birth, vacuum delivery, colic from day one, not the tummy issues that show up at 2 to 3 weeks of life. The baby that's colicky from day one, to me, especially if there was a lot of birth trauma, that is like a huge red flag that there's some kind of restriction. And it happened to our own daughter. Our own daughter from day one was colicky as can be, ultimately needed some work, osteopathic work, and then was fine. But when I see that, the child that doesn't crawl, and usually there's like this continuum, right? Difficult birth, colicky early on. Oh, we can never lay her down. Oh, we had to bounce her until she was like 6 months or 9 months old. Oh yeah, and she didn't really crawl well, and her walking was off, and this, and now she crashes into things, and so forth. And there's like a story that people tell. And, sadly, I keep seeing the same story over and over and over again. And that's why it is so important for these people to understand the work that you do. Because these are the children, and I think they are at least 20%, if not more, of the total population of kids with behavioral issues that have this history.
Right.
And I think for the parents out there, if you guys pay really close attention to what we're talking about, and we'll have a lot more information outside of this discussion to expand on all of these things. But if you guys hear that story where they had the difficult birth and blah, 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 this is where you need to be working with someone like Dr. Gill to rebalance the entire organism, the structure of the human body, to allow everything to reorganize.
Yeah, I think the physics of living in a human body is such that, unfortunately, our bodies remember injuries and impacts. And this actually goes down to the cellular level. When you make a muscle cell, it's spindle-shaped. When you make a biceps, it's spindle-shaped. So we respond to tension. We respond to impact in a very specific way. A force, its direction, its duration, its frequency, its intensity is a language to our physical bodies. So then if you back up and you think of that information, and you back up and you think about a fetus that's growing inside of a woman, and she has a large fibroid that the baby has to grow around, that has an impact on the shape of this child, and they have to accommodate it. If there's twins, I always like to talk about the sat upon twin. There's the Buddha baby twin who's kind of above and doing well, and then there's the one that was squished under the other one. And those children, for their lifetime, retain that physical experience of being sat upon. How it manifests is different. Usually those babies are difficult to soothe, and they're irritable, and they have to be carried more, and they need more special types of cuddling, and it bears out even in their adult life. I have some patients and friends who've been through that as twins, and they will definitely state that they were difficult babies all the way through, the twins. Also, if you have a child who's born from a transverse lie, in other words, they're lying from the head's here and the butt is here instead of the other way around in the mother, and they have to go through some sort of a turning process from the obstetrician, that creates a tremendous amount of strain in the baby's mechanism. And of course they can overcome it. There's lots of people who've gone through life with that irritant constantly bothering them, and they do okay. But imagine what you could get out of the way for the child if you could unravel that pattern and say, you know what, this is no longer useful. It's the same way that we unravel it if an adult is in a car accident and they get impacted from the side, and if the impact comes from the right-hand side, it affects the neck, it affects the back, it affects the position of the heart, it affects the lungs, everything. And that stays there. Advil doesn't change that. It will not change it. So it's because we start out with the physical message. The cells respond to impact, stretching, compression. That's a language for them. And that's just the way we are as human beings. So if we understand that, then we can go back and look at the baby that got sat upon in utero, or the baby that had the difficult birth and, had a lot of traction on their neck and their arm doesn't work. There's many, many reasons that it would be wonderful if every child on the planet got a chance to be evaluated by somebody who's trained in osteopathy, just to see, is there something we can do for you or not?
Absolutely. I would 100% agree. If people had that opportunity, I think that would be a huge win for so many kids. Now, I think for a lot of our audience, that they're looking at this video and they're scratching their heads. They're like, okay, this all kind of sounds cool, but how does that affect my child in their mind and their nervous system? Can you, I know there's a lot to this, so you can't totally oversimplify it, but can you help our audience understand how physical, structural, cellular restrictions ultimately cause the nervous system to go haywire? So we kind of touched on it, that basically these kids are not integrated in their bodies. But I think to make it real for the audience, they've got the kid with anxiety. They've got the kid with over-the-top ADHD, that medications have failed, everything is causing issues, so forth. How can they understand how it is that the physical body and whatever restrictions or tightness or whatever is within that would ultimately affect this thing?
Okay, well, let's try a couple ways of dealing with this. One, imagine yourself having a really, really bad day. You've got a headache, you've got a sinus infection, you've got to go to work, you stub your toe, and somebody comes up to you and starts complaining to you at work. Is it going to be easy for you to deal with that complaint? Or are you going to have some challenges? So that's just, putting yourself in the sensory experience of what it might be like for a child. Here's another example. Anybody who's ever had a pinched nerve in their neck, the MRI will show that the nerve itself, as it's exiting the spinal cord and going out to help your arm move or help your arm tell that it's having a sensation back to your brain, actually is pinched. It's obstructed. So there's a mechanical impact on this nerve. If it's a sensory nerve, you're going to have pain. If it's a motor nerve, you're not going to be able to move your arm well, or your muscles are going to start to atrophy. They're going to shrink and not work for you over the long run. So that's an example of a nerve. The brain is like a Ferrari. It's very, very finely tuned. It has specific needs about how much blood sugar it gets. It has oxygen needs. It has minute chemical changes that it must have access to. And many of these kids who have severe ADHD, I find, actually have some disruption in the lymphatic system for the brain. They can't do their cleanup. They can't get rid of byproducts and just parts of their metabolism of the brain. So that affects something we discovered in 2015, which is the brain has lymphatics. They're called glymphatics. And this is something that the osteopaths have worked with for probably over 100 years. And we're the only ones who actually know how to get that cleanup system to start changing, getting rid of the detritus in the brain. Maybe another example, in Alzheimer's, we build up amyloid, beta amyloid, and other factors. In Down syndrome, sometimes you can see more beta amyloid in those children. Why is that? How are those two related? In Down syndrome, children have a structure that tends to be very compressed. The whole skull is very compressed, which is why you see the position of the nose and how the sinuses don't work very well for these children. You see the tongue position. If they can get treated early on, it's possible to change the shape that they will develop. And so that will have an impact on how much beta amyloid will be built up in these children. I'd love to do a study about it, but I mean, it's one mechanical example. I don't know if that's too esoteric for what we're trying to get at.
Not this. It makes sense, I think. So it's kind of like that. There's a traffic jam of stuff going into the brain.
Yeah.
And the sewage drainage system of the brain could also be clogged. So you could also even have both traffic jam of stuff, good stuff going in, sewer system is plugged up, so whatever should be coming out is also blocked.
So you're working with a toxic, with poetic license, a slightly toxic brain.
Yeah.
And you can't deal with the normal things that a lot of children have to deal with: air pollution, water pollution, chemicals that are in our foods, other things, because you can't clean it out.
Yeah. It's funny that you touched on the facial shape of some of these children with Down syndrome, because I mean, it blows me away how often these kinds of things are overlooked. Because I consider myself really lucky to have gone to osteopathic school and then to be working with people like you, because I've been taught to look for things, and it's mind-boggling. I've had kids come in and I can literally, once you look closely, it's like one eyeball is actually off from another, or their facial shape is kind of distorted.
Yeah.
And some of the parents are like, yeah, we kind of noticed it, but we asked the pediatrician and they said it's normal.
Yeah.
And these are the scenarios where I think, because the pediatricians don't know that there's any possibility to do anything with that, and they weren't taught that this mild degree of asymmetry is causing any issues. They say it's normal. So the parents have no reference to consult with anyone, right? They've never been told that this is, one, abnormal, and two, if it was abnormal, there's the possibility of doing anything about it. And I've seen cases, and the families have come back, and they're like, oh my God, it's crazy. After one treatment, suddenly Johnny's face looked wider. The nose opened up. The eyes actually started shifting. And these are all little things that make a world of difference for these kids, right?
It does. And, I guess I'm going to say two things. One is, it sounds really strange that somebody's face shape could change after a couple of treatments, but they can. And I think that throwing your heart over the fence, that there are people who really want to help your child, is an enormous supportive thing that you can do for your child, instead of coming into a situation and feeling like, ooh, is this safe for me to do? Is this a good idea? Is this not a good idea? Is it going to work? Because your child actually picks that up on a subliminal level. And if you're all in, those are the kids who really leap over the obstacles in such a profound way. Even children who have tremendous tremendous obstacles to deal with. There's something else that you said that I
Well,
wanted to touch on, but
I mean, if you don't mind sharing with the audience, so like the eyeballs and just the asymmetry, I mean, that alone, if the eyes are off 1 or 2 millimeters, these kids can't track or have any decent depth perception because their eyes are located in different spots of their heads.
right.
But how would restrictions in the skull affect the cranial nerves, the vagus nerve? How would that impact the functioning of the nervous system in the brain? Just if let's say, like we talked about the blood flow and the drainage, but how about if there's physical restrictions? Let's say the baby that had the vacuum delivery, neck and head were jammed up. No one thought of treating them because most people don't know there's even the possibility of something to do about that.
Yeah.
How would that impact the child that's now 7 or 8 that's having issues?
Well, that's a really complicated question to answer. So
I'm asking the easy questions for you.
You're asking the good questions. I like that, Pidgeon. So let's see. I'm going to go back to, let's take a baby who has colic, because this is a relatively simpler example. A lot of times as the baby goes down the birth canal, the back of the skull will rotate. And there's 2 developmental parts to how the skull fits on the neck. And they're called the condyles. And just to either side of the condyles are the nerves for rest and digest, swallowing, and neck control. So many, many babies who come in to see the pediatrician with colic, spitting up, irritability, they held their head up right away, which is not a mature thing to do. It means there's tension and pressure on the baby's neck nerves coming out of the skull. Those infants actually have a mechanical tension on the nerves because of the condyles. The condyles are shaped kind of like skis, and so they could be in a parallel turn. One condyle could be higher, one condyle could be lower. In any case, that distortion in the bony part of the baby's skull presses on those nerves and it changes function. They might spit up more. They might have abdominal pain. They might make too much saliva. They might be constipated. All of that can relate to the condyles. It can relate to a lot of other things, but that's just a gastrointestinal result, a phenomenon that's pathological that results from bone structure changes. We're seeing a lot of plagiocephaly now, which is that flat back of this head. And I find, and I think you are finding too in your practice, that it's not just the back of the head is flattened. These children have torticollis. They always like to turn one side. They don't like to turn their head the other side. Oftentimes they also have issues with colic and they're irritable. So there's a lot going on as this skull gets more and more flattened. And the really difficult problem is because of the Back to Sleep program, they tend to lie on the back of their head and they're going to roll to the flat spot. And so that actually increases the issue with it. These children can be affected on a number of levels, and there are associations with neurodevelopmental problems. They're slower to learn to roll over. They may have language problems, tongue control problems, and sometimes this plagiocephaly is associated with a developmental arrest in the mouth. So the tongue and the mouth can be abnormally formed. They can be tongue-tied, etc. So
the picky eater who eats at the age of 8 cream cheese sandwiches, peanut butter and jelly sandwiches, and mac and cheese, and that is their entire diet. And as soon as they try to put a piece of steak in the kid's mouth, they gag. And they had this entire history all the way back. Things may not be totally disconnected. It's just the human being that had the restrictions, the dysfunction, is now 8 years old, still having the same problems they had when they were 3 weeks old or however many months old. So things, even though they seem to have changed, they have just morphed into another form of the same thing.
And the child's trying to compensate.
They're
going to choke. It's going to make them gag. They're not going to eat that kind of food. They're not trying to be obnoxious. They just
can't.
They want to survive. They want their airway to be free so they can breathe, and they want to be able to survive. So it's a big deal.
Along these lines, if let's say we've got the 8-year-old, what will be signs in the 8-year-old that they have imbalances, let's say? Imbalances in the structure, other things. So the picky eaters, the kids
chronic sinus infections.
Okay.
chronic ear infections.
Usually on one side, right?
Oftentimes on one side. Tongue dysfunction, speech issues, whether they have a lisp or they can't they can't pronounce their R's, or, some of the more difficult sounds to make with the tongue.
Okay.
Some of these kids have chronic headaches. I see a number of children with chronic headaches who are 8 and 9 years old. And what else?
They may have tracking errors or reading
Yes, they
challenges.
can have ocular dysfunction. Absolutely.
Okay.
Anything. The head has the brain inside of it, the eyeballs, the sinuses, the tongue, the eustachian tubes, the ears, anything that's contained within the skull. When that container is warped, it's going to affect the function of what it houses. And our brain affects everything.
Yeah. I mean, it filters our experience of life.
Right. So what would it be like to suddenly be able to appreciate smell, or have your tongue work? It would be so freeing. It would be a whole new lease on life.
Yeah. In Holistic Minds, we have this animation where there's this very foggy kind of hazy picture, and then there are lenses that come in that basically clarify the picture. Basically, through your work, by restoring the function of the body and ultimately bringing the nervous system in line by restoring the function, what you're doing is basically bringing clarity to the experience of life that this child has.
Right. So they go from snow on the TV set to realizing that they're looking at a giraffe, and it's exciting for them. Yeah, it makes them happier. I think that's another piece of the puzzle is we don't have a pill for well-being.
No.
We don't. And we have a lot of different therapies, but somehow by recruiting all these functions that are dependent on structure, these children get to start to experience well-being. They can digest their food. They can utilize their supplements and actually get it from their stomachs to the place that it was designed to help. It makes a big difference for them.
It does. And that's why I'm so excited that you're here sharing what you know and your truth and the 2 decades plus of experience you have.
Yeah.
Because I really think people need to hear this. And one of the things that I tell every family is if you're looking for one pill to fix your child's problems, this discussion is not for you. I'm not the person for them. If they're looking for the magic vitamin that's going to transform their kid, they're in the wrong place.
Mm-hmm.
But if they're willing to do the hard work and they really want to help allow their child to regain their health and vitality, then they're in the right place. And it's by bringing all of these pieces together, and sometimes I've seen osteopathy alone do magic tricks, but sometimes we also have to address the gut, and we also have to address the metabolic functioning, and that's really part of what we're trying to do here. But it's to allow people to at least know that there's the possibility of something in this domain that could be causing problems, and there are solutions, right?
And it's also wonderful to work as a team. I mean, I'm having so much fun learning from you and the collaboration, and each one of these children has many minds kind of focusing on them and thinking about them and wishing them the highest good in all the things that we're trying to do.
Yeah.
So that's fun.
It is. Great. It really is.
I think a lot of other doctors get to do this.
No. We're very, very fortunate in that sense. And, over time, I think through some of your mentorship, I hope have gotten pretty good at sniffing out the cases that have the restrictions. And usually like halfway through a case, I'm like, yeah. And then like I'm just sitting there waiting for them to come to see you, and then sure enough, like once they see you, the mom's like, "Oh my God, Johnny's doing blah blah blah,"
That's
and that's the beauty of our collaboration. I'm very grateful.
Yeah, me too. Thank you.
Yeah, thank you. Is there anything else that you think our audience should know?
Let's see. So I think I tried to get across that osteopathy works on a very basic physical level, and we can deal with issues of pain and dysfunction, but there's also kind of a broader way to work with children, and we can have an effect on things that are not necessarily physical, and that's very hard to explain. It's kind of the same thing as when you suddenly think of a friend and then a moment later they call you on the phone. There are aspects to being human that we're only just being able to document scientifically. And the fascinating thing to me about osteopathy, it's you're continuing to learn all the time. You're trying to bring in more and more and more data about what could possibly be affecting this child. So, for instance, if a couple have adopted a child, there are certain things that can be done osteopathically to support that child facilitating in the family, and including their birth parents. And I have seen that make a change in an adoptive child's life, or several adoptive child's lives, who weren't sleeping. So sometimes that's not what needs to be done. There could be other complicated issues, but we really can address so many arenas of living as a human being. And I think part of what osteopathy does is it receives and sees the individual as a whole person. And in the way I was trained, we look at what's the illness and we look at what's healthy about the child, and we hold both of those with equal reverence. So those are both important aspects of who they are and how they're navigating in this life. And this is not bad and wrong. It's something that we want to support with their health, because you can't, cut it out of them and discard it.
But you can support the health element of that child and allow that health element to then wash away the dysfunctional part.
See the rest. Yeah. In their own specific time. We're not coming in and saying, you need to change this right now.
Yeah.
But we're saying, here are some supportive things that we can do osteopathically for you, and you can pick and choose. Your health system can pick and choose about how much of it it's going to take and what it's going to do with it. And that kind of permission is also what allows them to get to the end of the football field. Forcing somebody into a solution never works, whether you're a child or an adult.
Nope. And it's funny that you say that, because when I had started practicing herbalism, I thought, well, more is good, and I'll just push this system along until multiple children's bodies slap me in the face and like, no, don't do that. And over time, I've learned that gentle hints in terms of what you need to be doing. So I literally use maybe a quarter of the dose of the plants I used to and get much better results, because it's just little tiny nudges or hints go a lot further than a big kick.
They do. And with children, when they're treated osteopathically, you don't take the treatment all the way to the end point the way you would an adult. You go to a certain amount and then you stop and you see if they're going to take over. And they actually, I've had lots of children who lie on the table and very peacefully and enjoy their treatment. And all of a sudden, when I think we're still going, they just become antsy and they want to get up. Okay, we're done. No matter whether I want to finish this part or not, we are done because they're done. And if I push it further, they don't get as good a result. So amazing? Learning to let them communicate, where their end point is. I've had enough for today. I'll take it from here.
Brilliant.
And trust them.
Brilliant. Thank you.
Thank
you so much.
You're welcome.
Thank you for listening. I really hope this has been of contribution to our audience, and I really hope they can take in and appreciate this wisdom, because God knows how many children's lives can be impacted by the work that you do and others like you who are all trying to really heal children at the core level.
Right, absolutely. There's a lot of people who do this work, and they're very, very good at it. So
we'll be sharing a link so people can look up doctors close to their family, so that they can find someone close to home, hopefully.
Wonderful.
Thank you. And thank you all for listening. This is Dr. K from Holistic Minds.